Hello, welcome to the live broadcasting of Erufu, the online community medical support network. I'm Shireen. Do you know that we actually have air spaces in the skull located at the forehead, cheek, nose, between the eyes and behind the eyes? These are called sinuses, and they can be problematic when infections gets in. You are sneezing, coughing. You have used up an entire box of tissue and your nose is bright red. And so from all the whipping and blowing, are you down with seasonal cold? Is it a flu? Perhaps not. No worry, tonight we have a family doctor, Dr. Liew, the healthcare partner of Erufu Care, to tell you what is the common nose and sinus conditions that your family doctor can manage. Welcome, Dr. Liew. Hello, Dr. Liew. Okay. Before Dr. Liew have to start, I just do a brief introduction on Dr. Liew. So Dr. Liew is a general practitioner with clinical interest in ENT, ear, nose, throat, dermatological and minor surgery. He is graduate from the University of Aberdeen, Scotland, UK in 2011 and completed his housemanship in Singapore. He has years of training experience in ENT department of GHKL and also holds a postgrad diploma in dermatology from Cardiff University and a postgrad diploma in aesthetic medicine from the European International University in Paris. Dr. Liew has a keen interest in holistic and comprehensive management of his patient, which includes the integrations of the latest available technology to obtain the best possible clinical outcomes. No more further delay, I shall pass the sessions to Dr. Liew.
Thanks, Sharon. Thanks for the lovely introduction, and thanks everyone for joining us this evening. So tonight, I'm just going to open up the slides. So tonight, I will be doing a bit of sharing on the common nose and sinus conditions that a family doctor can manage in our clinic practice. Just a little bit of a few points before we actually start. I will just be sharing this in my capacity as a family doctor, not as an ENT specialist at all. I'm not representing any medical body, and this is by no means a substitute for any proper medical consultation. It's a sharing basis. Okay, so let's get started. Your nose and your sinuses, what are they? The nose it's your nose, it's right in your face, and but did you know that right next to your nose, in your face bones, there are actually little air pockets surrounding the space in your nose, and these are called sinuses, paranasal sinuses. So there are a few segments that we normally talk about. There are the frontal sinuses, which are at your forehead, and there are the ethmoid sinuses in between your eyebrows, and of course there are the maxillary sinuses, which are on the near the cheeks. Also of note, inside your nose there are little meat-like protrusions called the turbinates that you can actually see on this picture. There are generally always three layers: the upper one, the middle one, and the lower one, superior, middle, and inferior. And they each have their own, they play a role in the function of the nose as well. So why do we have all these structures in our face? There has to be a reason for all this to be there, right? That's right. Because our nose is actually much more complex than just smelling things. Let me elaborate a little bit. Of course, the first function of the nose is to let us breathe in air. So a vast majority of the air that we breathe that flows into our lungs from the outside actually by right should pass through our nasal cavity, our nose space in health. And this actually allows the air to be humidified. It's warmed as well. And the narrow passage in the nasal cavity actually helps to filter out a lot of things that we don't want to get into the lungs as well. Things that are too large, for example. It is a kind of filtration and defense system. As well as that, I'm sure we all know that the nose plays a major part in our sense of smell. The sense of smell is a bit more complicated than just smelling. It also plays a role in how we perceive taste of food. Yes, that's right, taste of food. So aside from the usual salty, sour, bitter, all that kind of thing, the more complex aromatic sense of taste, it comes from the nose actually. And more complex than that, there are actually very subtle function of the nose as well. Some studies or some scientists will purport that the nose actually plays a role in human-to-human attraction as well. And it's very subtle. Most people wouldn't even realize it as well. Interesting. And of course, last but not least, the nose actually plays a very important role with the sinuses in the face to help resonate the sound that comes out from our throats. So this sound gets its unique quality from the acoustic of the room, which in this case would be the nose and the sinuses, amongst other space areas in the throat and the upper airway. And having that particular quality of sound gives us personality, gives us identity, and gives us a sense of who we are. So it's very important. So what are some of the conditions that we can suffer from that are very commonly presented in a family clinic? So one of the most common conditions from the nose that certainly I would see in clinic is a case of blocked nose. So this is very, very common, and normally in health, we do have some resistance of the air flowing in through our noses as well. And this is normally quite a healthy thing. However, sometimes, for whatever reason, there can be too much resistance. And when this happens, people will start to feel a sense of obstruction in their nose, and then they start to come. And actually, there's so many reasons for it. So what can the family doctor do in these situations? As with a lot of other medical conditions, it always starts off with a little bit of a chit-chat. And through this kind of chit-chat dynamic, we can get some information on the illness, and we can find out a little bit more about the details that we need to find out to come to a more definitive diagnosis. It clues us in very well. So the history or consultation, and of course after the history, we will always try to examine to try and figure out in more detail what is going on. So as you can see, there are quite a few things that can be done in the family doctor's office as well. Of course, we will look into the nose to see what's going on there. And we can also look in the ear, we can look in the throat. Don't forget to listen to the lungs, a few of this kind of thing, check the neck. And these are all associated areas that may clue us in on what the possible problem could be. So, of course, when you have a blocked nose, you will be wondering what is happening. There are a few more common causes, and I'll just talk about those. So, of course, there are some problems which are more physical, and you can actually see them. So, one of the problems is when the middle part of our nose, which is called the septum, which separates both the nostrils compartments. Sometimes in some people, as they grow up, or they can be born with it, there can be a little bit of a curve, and that's fine. But when it gets too curved, sometimes it can play a role in blocking the air from flowing normally. And this sometimes has to be corrected because it causes a considerable block in the nose due to too much resistance on one side. And sometimes there can be a polyp growing inside the nose. Polyps can grow and normally they need to be assessed properly with a good look inside. And many a times when the family doctor does find the polyps, it's probably a good idea to have a bit of a checkup with the ENT specialist as well. For children, sometimes there can be a little bit of nose and the back of the nose and the throat area involvement as well. an adenoid area, which is a little fleshy bit at the back of the nose, near what we call as the nasopharynx. It can sometimes get swollen and enlarged, and this can actually cause the nose to get a blocked sensation as well. And of course, if things get lodged inside the nose physically, foreign objects that need to be removed, then they normally have to come out. And a lot of the times, it's quite a safe thing to do to actually, when a family doctor finds these, it's probably safe to discuss with an ENT surgeon or an ENT specialist to see what is the best way to go forward. And of course, last but not least, in the more physical causes, there's always a consideration of the potential of nose-type cancers. However, these things, when we pick them up in the family practice, they generally have to be managed within an ENT specialist capacity. However, the initial presentation can sometimes be very, very subtle. And these subtle signs can sometimes clue us in on what the potential problem can be. And so it is sometimes still very important to get a checkup from a general doctor as well, so that we can get an idea of what the possible cause might be. Okay, some of the less physical causes are shown in this slide. Of course, if you're getting an infection in your nose, sometimes it can swell up the inside of your nose and cause that blocked sensation. Sometimes it's due to allergies. Sometimes it is due to medications even. Certain types of medications can cause the fleshy bit, the turbinate that we mentioned earlier, to swell up a little bit more. And sometimes this size can fluctuate up and down, and that causes an occlusion or blockage of the airflow. And of course, sometimes they can be a bit hormone related as well. Some fluctuations that are abnormal in the hormone levels can also cause a sensation of blockage in the nose. It's also particularly important to note that certain types of decongestant nasal sprays, when used in a long period of time and not monitored in a careful way, can actually cause medically induced nasal blockage. And that is why sometimes it is very important to follow up with your doctor that started the medication to make sure that it's being used properly. And what about allergies in the nose? So next topic would be about, not particularly about blocked nose, but more about allergies that manifest in nose symptoms. So what are the typical things? This is actually a very common thing as well. Sneezing, running nose, itchy nose, that it sometimes can manifest in a bit of ear pain. Sometimes it can manifest in coughing, and there can be a lot of associated conditions with these allergies as well. Very commonly, asthma comes together with it. Sometimes more of a dental subject, but sometimes the teeth, the upper and lower teeth, don't really match together when they clench, and they may require some dentist assessment as well. And even the skin can be involved in these sort of allergies, commonly coming together with nose allergies, things like eczema. And so about nose allergies, a lot of the times they are diagnosed as allergic rhinitis. Of course, it is best to talk to your doctor about what the proper diagnosis would be. Some of the causes of allergic rhinitis will be dust mites. Sometimes they can be other types of external triggers, such as pollen. However, the pollen is sometimes more commonly affecting countries that are more temperate with 4 seasons. So in equatorial climates like Malaysia, normally we get these sorts of allergic symptoms throughout the year. And it's quite useful to have a look at the picture in the lower left as well, where you can see one side of the nose, the turbinates, those fleshy bits that come out into the space of the nose, they look quite normal in size. However, on the other side, where it's labeled enlarged turbinate, it's actually a little bit swollen. And in this case, they're trying to show that it's swollen due to the allergic irritation. And a lot of the times, this process is very closely linked to your body's own immune system. This Y-shaped thing here is not a slingshot. It is a chemical makeup of an antibody, which is the type of immune soldier in your body that triggers this immune reaction, particularly called IgE. So nose allergies. You seem to have the symptoms, we're not quite sure. So how do you know? There are a few tests that doctors can do for this condition to find out more, depending on the type of practice. However, in general, family doctors would be able to run some blood tests, which check the level of these allergic antibodies, which may clue us in to what the possible causes may be. And of course, in the lower left as well, we take a proper chit-chat session and consultation, and we try to find out what is happening just from the fine details in the way that the problem presents. And a lot of the times, this can give us a very good idea already before we confirm it with any tests. And of course, in the upper right corner, there is a picture of a test that we can do for checking skin allergy in relation to nose allergies. This particular test is called a skin prick test. However, sometimes you may wish to consider doing it in a hospital setting as well. And in the lower right corner, there is a picture of a person being examined. And of course, one of the ways that we can actually see whether there's any allergy or not in the nose is really just by looking into the nose. And some of the details of that examination can help clue us in on the most likely cause. You know, is it how swollen is it? How red is it? How blocked is it? Nose allergies. What can we do about nose allergies? So in a lot of sense, medicines play a big role, no doubt. Anti-allergic medications do help, and they're quite safe. Quite a lot of them are quite safe to take in the long run. And certain types of nasal sprays can be used as well. And of course, in the left side, in the right side, this rather satirical picture shows a man enjoying a field of flowers, but wearing a mask. So what it represents is trigger avoidance, which means if you are finding that you are triggered by certain types of external factors, try to avoid them. Sometimes easier said than done, but once you understand what triggers you, it can be possible to try and make some accommodation to distance yourself from them. That can help. And of course, if all else fails, sometimes there can be an option of what we call as immunotherapy, which helps to make the body resistant to, or rather more used to getting triggered by certain types of allergic trigger. And once it gets more used to it, the allergic reaction generally gets milder and milder. However, this treatment can sometimes be very slow moving, and there are many forms of doing it nowadays. So it's good to get a chat with your doctor about it as well if you're interested. And this hourglass here at the lower part of the slide actually is just there to let everybody know that you shouldn't be abusing nasal sprays longer than your doctor tells you to, because it can cause rebound nasal blockage. So what about your sinuses? So we talked about the nose. What about the spaces in the face which are next to the nose? Why are they always associated together, the nose and the sinuses? It's because they're actually connected physically. There's a bit of a window in your nose cavity which connects to your sinuses. And normally when your nose gets irritated, the cell lining around these air pockets in your face get puffed up as well. And they get irritated. And when this happens, sometimes fluid can accumulate. Sometimes they just get inflamed and irritated, and that is causing symptoms, and that was what we call sinusitis. So some typical symptoms of sinusitis would be loss of smell. Sometimes you get a bit of a headache and a bit of a congested feeling in your face, especially in your cheek areas and the in between your eyebrows, the forehead. Sometimes you can get very foul-smelling breath, and you can even get some tooth pain as well, because it's so near to the teeth. So yeah, it's interesting. So rhinosinusitis, basically inflammation of the nose and the sinuses. What can be done? From a family doctor point of view, we generally would be starting medicines very similar to the nose allergies, or if we identify a kind of infection and it's something we can treat safely, then we would probably start the treatment first and monitor the process as the case goes on. Another thing that we can do is we can try some sinus rinse or nasal douching, which is basically a salt solution of a very clean water in a bottle that is shot into one side of the nose, which helps to rinse out the cavity of the nose of the germs, as well as allergic trigger like pollens or dust or whatever. Just rinses everything out and causes less irritation. Now, a lot of the times, rhinosinusitis has to be assessed with the duration of the symptoms in mind. And if it gets too long and it is very recurrent, the best course of action is, of course, that we may, as a family doctor, we may propose to get an assessment from an ENT specialist or an ENT surgeon, because sometimes surgery may be a better option. So when you have sinus problems, it is important not to ignore them, because being in the face area and in the head, there are so many important organs around your face and your head area. And if it really turned out to be a sinus condition that is caused by a dangerous infection or something that can spread quite quickly, there's so many important organs around the area that can get affected, such as your eyeball, your brain, your nerves, some important blood vessels that can cause long-term damage. So don't ignore. Yeah, don't ignore. Okay, nose bleeding. Just a little bit of mention about nose bleeding. What do you do at home? So a good first aid measure, of course, is to try and stop the bleeding by putting a bit of compression at the bleeding site. A lot of the times, the nosebleed comes from the front part of the nose, and this is actually possible to be managed by putting a bit of pressure, pinching with the index finger and the thumb together at just in front of the nose, below the bony bit, what we call the vestibule, and this normally helps to put enough pressure on the bleeding area. To help with the limitation of the blood flow to the bleeding area as well, you can ice the forehead, or you can put a little bit of an ice cube in the mouth area as well. And this normally helps to shrink the blood vessels around the area and help control the blood flow that is flowing out through the nose. And of course, lean forward when you do it. If you lean backward, the nose is connected to the throat, and some of that blood could trickle down the throat and cause a choking. So lean forward. And you know, if it doesn't resolve in like 15 minutes, you probably want to go and get assessed at an emergency department as well. So after all that mention about, you know, what your family doctor can do, what you can't do, when to send off, when to, you know, try and get assessed properly in clinic, in family clinic. So I hope I didn't add to the confusion. Who do you see if you have a nose problem? Is it the family doctor or is it the ENT specialist? Truth be told, there is a role for both doctors, both types of doctors. In general, when the condition is less complicated, when less severe, you can get an early differential an assessment from your family doctor, who can decide if it is something that we can treat or something that we need to send on to a specialist. And there are so many conditions that an ENT surgeon is the definite right doctor to manage. So in general, as a family doctor, we would be able to send you along to the ENT specialist when we know that it's something that we can't manage. Okay, so what is the conclusion? The conclusion, I would think, or the take-home message would be that don't leave your nose conditions untreated for too long. They actually affect all people from all walks of life and all age groups. And the earlier you get them settled, the better, because there are a lot of subtle long-term consequences to having unmanaged nose condition. Attention spans can improve for kids when their nose conditions clear up. And then when some of the nose conditions can actually cause snoring in adults as well. And this affects quality of sleep. And then when you're not well rested, you're not going to be able to work that well. And, just the daily functions of life. And it can be dangerous as well when you're driving and such. So yeah, get checked early. Thanks for listening.
Okay, thank you, Dr. Liew.
Yep.
You can stop sharing.
Okay.
Okay, thanks for friends actually still with us. Now we actually go into the QnN sessions, and seems like this is a quite interesting topic, and we have lots of questions on live already. So let's start with their questions. Okay, maybe do ask doctor that do essential oils helps with nasal congestion?
Not that I know. It's as far as I know, as a GP, it's not something that we find has a very consistent result. However, of course, if you find that it works for you to relieve and soothe some of the irritation, you can use it in moderation. However, I do think that if it's not really working out, don't really wait for your symptoms to get worse. You shouldn't delay getting an assessment from a clinic.
Okay, that's right. Another. Hi, Jolene. Jolene have a question that how do I deal with post-nasal drip? It happens every morning.
Okay, so post-nasal drip normally comes from the nose, and then because the nose is connected from the back to the throat, if it doesn't come out the front, it's going to flow down the back, and it's going, if it's going to flow somewhere, and then it kind of irritates the nose as the throat as it goes down the back. So yeah, I think the most practical approach to managing post-nasal drip is actually to reduce the discharge from the nose, because when you don't have that discharge coming out from the nose where it originates from, then it's not going to flow down the throat. It's not going to irritate the throat in the morning. So again, it's probably best to get assessed by your doctor to find out what the most likely cause of that nose discharge is going to be. Yeah, it could be allergy, could be infection, could be a combination of both, it could be something else.
Okay. And Jolene also actually asked second question that does menopause trigger sinus like you mentioned, hormone fluctuations may trigger it?
Okay, so normally hormone fluctuations can trigger nose blocks and nasal discharge, but in general, I think it's normally closely associated with spikes in hormone rather than lack of. Yeah, as we get older, and then as we get as ladies move into the menopausal state, generally not quite, but I think there may be other underlying conditions as well that could cause it.
Okay, then we have Joshua that actually asks, are there other ways to fix a deviated septum? One of his nose holes has less efficient airflow than the other.
I'm sorry, what one of his?
Are there any other ways to fix a deviated septum? Because he says one of the nose is having lesser airflow on it.
Of course, yet again, it's probably best to get an assessment from a doctor, because there could sometimes be other associated condition that may cause that sensation of blocking. No doubt, if you look at your own nose in the mirror, sometimes you may find that the nose middle of the septum is deviated. You may be able to see that, but sometimes deeper into the nose, there can be another reason that's sitting in there that you can't see that could be causing that feeling of blockage as well. But pertaining to whether you can correct it without surgery, I think not to my knowledge. However, it's not always necessary. If you're not having very serious symptoms, it may not be the first thing to do.
Okay. Okay. This being you is actually asking, if I can't evade the triggers, would taking antihistamines help? How often can I take it?
Yep. Okay. So in general, antihistamines are quite well tolerated, especially the newer ones, quite safe. So yeah,
you mentioned Zantric, ZYRTEC.
Oh, Zyrtec. Yeah.
Zyrtec.
Generally quite safe to take in the long run. I don't think there are any very serious consequences, and in most people it's quite well tolerated and you don't get drowsy. Given there are certain types of allergy triggers that are very difficult to avoid, such as in tropical and equatorial climate like Malaysia, dust mites flourish in our environment, and it's not seasonal at all, it's all year round. So good luck in trying to avoid that. But having said that, that is when you can actually kind of discuss with your family doctor and then see if it's worth having a conversation with your specialist as well, and see if you want to consider some kind of immunotherapy if the allergic triggers are irritating you that much.
Okay. Elise is asking, is pinching your nose when you sneeze is bad? Pinching your nose when sneezing, is it bad?
I don't think it's particularly dangerous. Of course, there are some rare conditions that can happen from, so what happens when you pinch your nose when you sneeze, right? So some pressure builds up in your nose because you're releasing the pressure suddenly. And of course, this pressure has to escape from somewhere. So a lot of the times it moves into your middle ear through your eustachian tube, and sometimes it has to move somewhere. So potentially eye conditions can be triggered by this sudden buildup of pressure. Sometimes it can be your eardrum getting damaged, but by and large, I think they're generally quite rare, but it can happen. So I don't really recommend doing that. Proper respiratory hygiene, I guess, does still apply. So if you need to sneeze and you're in a public crowded place, you can, instead of blocking your nose, closing it completely, you can, you do the sneezing into your your antecubital fossa, this fold here, or you can sneeze into a cloth or something that you can retain it in.
Okay, Kenneth had asked this question. Does it make it worse if I keep rubbing my nose when I have a sinus outbreak?
Okay. I don't think it gets worse, as in your symptoms wouldn't get worse. However, there could be consequences on the skin of your nose area. Certain type of persistent rubbing does eventually cause wrinkles and marks that you will definitely be able to see after a while. So I don't think so, unless you're scratching the inside or rubbing or blowing too aggressively, that can actually trigger increased risk of nose bleeding.
Okay, there's another question from Jane, is that she finds difficulty in breathing under mask wearing. Is there any problem with this nose problem or ear problem? Difficulty breathing during wearing masks.
Yep. I think it's quite normal. Sometimes, as we, nowadays in the new normal, where we have to wear masks more often than we normally would. Definitely, there's a bit of that getting used to it, and sometimes it's very difficult to acclimatize or get conditioned to this kind of new feeling, getting that extra extra layer in front of your nose and your mouth. So yeah, I mean, if you've taken off your mask and you're still feeling that difficulty in breathing or that obstruction, then maybe you want to get assessed as well. There could be a lot of underlying causes, but generally it's not that uncommon. I guess it's going to be an extra layer that's going to cause extra filtration and resistance. So yeah.
Okay. So actually, you have talked about nose conditions like flu, also like sinusitis. In what condition that I can differentiate both? I mean, in what situations that I know, oh, I am having sinusitis or just normal cold?
Yeah. So it goes back to the first slide where we saw the nose and the sinuses as different cavities in the face, right? So if you're having particularly just the nose irritation or inflammation due to whatever reason, the symptoms are more specific to the nose. So you will have runny nose, sneezing and whatnot, itchiness. And if it's more pertaining to the sinuses, then you may feel symptoms like face congestion, a bit of a headache due to the irritation of the lining of the sinus mucosa, the skin around the inside of the sinuses. Sometimes you may have a bit of a bad breath, which generally does not occur that often in other conditions.
Okay. And then just now you talk about migraine. Why migraine or headache will come together when I'm having nose block or sinus?
I think sometimes it's a bit of a difficult one to separate because in the family practice at least, a lot of the times, as we said, we would be having a bit of that chit chat to find out what the possible clues to the condition would be, and that clues us in on what to look for next. And a lot of the times, migraine and sinus headache tend to present in a very similar way. So it's really about getting the details in that chit chat to kind of tease out what it could possibly be.
Okay. All right. So, okay, a lot of people actually ask, can sinus be fully cured? Because probably the sinus is due to the allergy. So, can it be fully cured, sinus?
It depends on the underlying cause, and it's a difficult one. This is a difficult one. I think in general, it can be controlled very well. A lot of the times, it is controlled so well that you actually don't get bothered too much by it on a daily basis. Whether it can be completely cured or not really depends on the cause of the condition. I mean, it all will result in that inflammation and that irritation, but usually they have a very different underlying reason for getting to that state. So it depends on that as well.
Okay, so actually just now there's I think Jolene or Manlin that has actually asked about using the essential oil. I think it's because a lot of people actually don't want long term to rely on those antibiotic or decongestant nasal spray for long term.
Yep.
So any actually natural way that actually can help for nose blockage. There is a sinus rinse in the market. So is that actually help to relieve the nose blockage? Is it good for that?
Yeah, I get it. Okay, so again, it depends on why. So I think in general, natural means do play a role as well. But I think for me, I would emphasize more on the general like lifestyle habits. Just by keeping well, not being diabetic, not having high blood pressure. Getting your proper sleep, your proper nutrition, exercising regularly, not getting too heavy or obese even. All these kind of general measures do generally improve the outlook of even nasal symptoms and allergies. Particularly if there's any kind of non-medicine or drug-related ways to control these symptoms, I would suggest probably you can try some steam inhalation on a very bad flare-up day if you don't have access to a medical assessment or some medical help. What you can do is you can we can get a bit of a container with a narrow opening. Pour a bit of hot water. Just be careful when you pour it so you don't get burnt. And you know, when the steam is coming up, just have a bit of cover your head with a towel and you have a bit of an inhale. And it tends to not too near to the cup as well, you know, and it tends to soothe your airway and moisten it a little bit. And sometimes this can actually calm down the inflammation and open up these swelling areas, which then ease a lot of symptoms like ear pressure and blocked nose.
Okay, there's also questions coming in from Jane. She immediately gotten into sneezing mood and with running nose under air conditioning for more than 10 minutes. Is it considered a sinus? What causes that?
So I missed the question again. Yep.
She immediately gotten into sneezing mood and with running nose when she's under air conditioning for more than 10 minutes. Is it considered a sinus? What is the cause actually?
I think sounds to me in general like some kind of irritation.
Irritations to the cold.
Yeah. A lot of the times when we have allergic reactions, it's not always it's not 100% of the time something we eat and you know, or something that we are inhaling at all. It could just be something that we are exposed to. For instance, something totally unrelated like skin allergies. Sometimes you can get skin reactions from something that's seemingly not related at all, like vibrations or sunlight, you know. So it can be quite variable, the triggers. So yeah, it sounds more like an allergic thing. It's best to, you know, get it a bit weeded out in the details of that chit chat with your usual doctor.
So usually like these conditions, what you can do is actually just stay out of air conditioning.
I think it's not so clear cut. Sometimes they may be closely associated with other underlying conditions as well. So as I mentioned earlier as well, there are other types of allergic conditions that can coexist with allergic rhinitis or like nose allergies. So you could be sneezing, but maybe there are other more subtle symptoms. Maybe you're getting some lung symptoms as well. There could be a component of some kind of asthmatic trigger and symptom, you know. It's very difficult to tell like this, but yeah, if it is allergic after being assessed by a doctor, then a few common treatments that would normally be employed would be things like allergic nasal sprays, allergic pills, and we normally try to weed out more fine details, such as you know, conditions that happen, you know, these events that happen before actually going under the aircon, you know, like are you actually showering before that, you know, how hot is the water and whatever not. You know, a lot of it is in just the chit chat and finding out more details about the circumstances, and that can shed a lot of light on what actually is causing the irritation.
Okay. All right, Jolene has another question. She's actually asking, generally, what is the cause of sinus based on your experience?
Commonly, I would say more allergy, and if it was an infection, which is probably going to be like runner-up, then more viral infection.
Okay. All right. Okay. Then we jump out of this sinus. Okay. About snoring. Can snoring be cured?
Yep. I think yes and no as well. It depends on your age that you present with these snoring symptoms, and it also depends on which area is causing this snoring to happen. You know, there could be any narrowing of the space in where the air flows, all the way from your nose to the nasopharynx, the back of your nose, all the way down to the upper part of your throat, and all the way down even, you know, just to like above your vocal cords, or, you know, so on and so forth. So sometimes it's a combination even, and that would really all result in the overall outcome of snoring and having that difficulty in getting that restful sleep. However, because there are so many areas that can narrow down and cause that snoring to happen, it really depends on which area is causing this this resistance in the airflow. Then depending on that level where that blockage or narrowing is, then normally it will have a better idea of whether it can be successfully treated or not. But if it's pertaining to the nose and snoring, only the nose and due to allergies, it sometimes can be managed very well.
Oh, it means allergies, people's actually allergies also will store.
Sometimes when there's a bit of a nose block as well, it can cause a bit of that difficulty to breathe through the nose. Then you may be breathing through your mouth more often when you sleep, and so on and so forth. And this can cause a bit of abnormal airflow when you sleep.
Okay. All right. Okay. Another one is normally for home care. Okay. How because sometimes serious nose blocks tends to cause ear pain. So let's say we are not going to seek for medical help. Okay, what can we do to actually relieve the pains of the ear at home?
Ear pain.
Yep, but because of a serious nose block, we will got ear pain.
Mm-hmm.
So how do we relieve it at home?
Okay, so yet again, if you're talking about home care pertaining to elderly patients, and you're having a bit of a persistent kind of one-sided-ish ear pain or ear block all the time, and you keep coming back and your nose is like quite well behaved or not, it sometimes may have more value to get a bit of a checkup as well from your family doctor or your ENT specialist, because sometimes it can have a very subtle cause that could cause this kind of persistent blockage. But in general, if it's just a short course and it's just happening over a few days, you can actually try something that you do on an airplane when you're actually taking off, or there's a change in pressure, which is basically just close your nose, pinch your nose, and just blow out through your nose, and that kind of opens up your eustachian tube to equalize the pressure, and that can help enough sometimes.
How about kids that actually don't know how to do all this? How do parents handle the situations at home?
Yeah, you can try something that encourages them to swallow a bit more, because when they swallow, then sometimes you can open the eustachian tube. So lollipops or sweets, if they're old enough and don't have that risk of choking too much, you can try that.
Okay. This is my last questions for tonight. I think we should be is close to the time. So my last question is that what is the reason of COVID-19 test sample collected via nasal swab sample?
Yep. Okay. I think it's because there's a large focus, a large concentration of that viral load in the upper part of the airway, with a strong focus of it sitting in the back of the nose area and the back of the throat. So generally, we try to swab from the area where it's highly densely located, so that we can try to pick it up as easily as possible.
Okay. All right. Thanks, Dr. Liew, for tonight sharing and also answer all our questions, clear the doubt of the public. And thanks for guys that stay with us. And if you find today's topics interesting and usable to your friends and family, do share around the videos. And if you think you have more questions, I have a link that how to connect you guys to Dr. Liew in our video post. You can just click in the link and look for Dr. Liew for further questions. Okay, before I end, I would like to inform that next Wednesday, we will have a talk by the medical aesthetic physician, Dr. Steve, about laser hair removal. For more details, do check out our announcement post. Okay, the right clinic, the right doctor, the right care, the right information, the right knowledge, no panic, mask on. Good night, Dr. Liew. Thank you for your time, and good night, everyone. Bye.